Next question deals with complications that one might experience with bioidentical hormone replacement therapy. And really some of these complications that you might hear about are more common with synthetic therapy than bioidentical therapy. So let's just talk about most common complications or possible complications that you would have if you're a female. Most common could maybe be some fluid retention. If that happens, that's usually the first set of pellets and it's easily treatable. Sometimes you might get an increase in acne just like you did when you were in your teens. So that could happen, yet very easily treatable. These side effects are very, very rare with bioidentical hormones, just like they were for you when you were growing up. All we're trying to do is take your hormone levels to what they were optimally when you were younger. So you have to think about it. Did you get those problems when you were younger? If you didn't, then most likely you're not going to get them now that you're doing bioidentical hormone replacement therapy. Same thing with men. Sometimes you might get fluid retention. Usually that's first set of pellets. Other than that, very, very minimal effects. You cannot make that statement with synthetic hormones because they act almost exactly the opposite of bioidenticals. When you talk about testosterone as synthetic, it's a vasoconstrictor. That means it decreases blood flow. And so it increases your risk of heart attack, increases your blood pressure, increases your risk of losing your hair, increases your risk of having strokes or any kind of thromboembolic or clot therapy. Natural testosterone is a vasodilator. It does exactly the opposite. So that means it causes hair growth, not your hair to fall out. It decreases your blood pressure. It decreases your risk of heart attack, strokes, pulmonary embolus. So sometimes when people talk about potential side effects, I'm not really sure that they're really complications. They're things that could happen, not will happen to you, could happen, and most of these are usually 1 to 3%. So my last recommendation on this particular question has to do with if you are experiencing of what you think might be a side effect, I would tell you, call your doctor. Your doctor can answer those questions, evaluate you, maybe repeat your levels, and say some kind of therapy options. That way, you'll get taken care of.